everyone. Welcome back to the Medigap Show, where we talk about all things Medicare. I'm your host, Holly Cohen, and I'm thrilled to have you join me here today. Today, I'm excited to share an article that could potentially save you lots of money. I just want to take a minute to introduce myself. I'm not just a host, I'm also the founder of MedigapCares.org. With years of experience in the healthcare industry and understanding the complexities of Medicare, I've made it my mission to help people who are starting Medicare, who have been on it for a while, to really understand it and understand how it works for them. We're going to uncover some little-known programs that have the power to help significantly lower your Medicare costs. Yes, you heard that right. Imagine what you could do with all those extra savings, whether it's investing in your health, pursuing your passion, simply enjoying life to the fullest. But before we dive into the article, let me remind you to hit subscribe and hit that bell icon to be notified for all the new videos that are coming your way. By doing so, you'll never miss a future episode packed with expert advice, money-saving tips, and everything you need to navigate the world of Medicare. So without further ado, let's dive right into this game-changing article. So here we go. Millions of Americans could save substantially on their Medicare costs with these little-known programs. From Fortune Well Online magazine. When Americans become eligible for Medicare at 65, they're frequently unprepared for one big surprise. Their out-of-pocket health costs can be enormous. In 2023, the annual Part B premium and deductible for doctor's visits and home health care totals $2,205, and the Part D prescription drug premium can run up to $505. Then there are coinsurance costs and medication copays before Medicare's catastrophic coverage kicks in. A hospital stay has a $1,600 deductible, and this year's out-of-pocket maximum for private insurers, Medicare Advantage plans, can hit $8,300 max out-of-pocket to see in-network doctors. Seniors are feeling the strain of these costs. A recent poll found that 75% of people with Medicare Advantage, Medigap, or Medicare Part D plans said they were worried about being able to afford their out-of-pocket costs. So I'm going to now go over the Medicare Savings and Extra Help programs that, again, not everyone knows about. So let's go through, and then there's just so many ways you really can save. What many Medicare beneficiaries don't know, however, is that there are 5 government programs that can sharply reduce Medicare out-of-pocket costs for low and middle-income people. These are joint programs from Medicare and Medicaid for people who are generally at or slightly above the federal poverty line. The programs help pay Medicare Part A, B, and D premiums and deductibles, coinsurance, and copayments. 4 of the initiatives are called Medicare Savings Programs, also known as Medicare Buy-in Programs or Medicare Premium Payment Programs. They offer substantial savings on Medicare Parts A and B. It's estimated that at least 1.47 million Americans could save about $2,000 or more each year through MSPs. Medicare Savings Programs can be a lifesaver, says Ann Karish, Senior Program Manager for Medicare at the National Council on Aging. For someone making $14,000 to $15,000 a year, $164 a month, which is the current Medicare Part B premium, is a lot of money. It could be a difference of whether you could eat or not eat, or actually also, by the way, take your medication or not. That's also part of it. The 5th Medicare subsidy program for saving on Part D prescription drugs is known as Extra Help. You automatically qualify for it if you're approved for any one of the 3 Medicare savings programs. The Social Security Administration estimates Extra Help is worth up to $5,000 a year. Why so few people sign up who are eligible? Only about half the people who qualify for Medicare savings programs use them, however. A February 2023 report noted that historically, MSP enrollment has been low despite efforts to increase participation. In North Dakota, just 7% of Medicare beneficiaries are enrolled in the programs. Low enrollment in the MSPs, that's again Medicare savings programs, has been an ongoing concern for policymakers. A 2020 report from Medicaid and Chip Payment and Access Commission noted. There's research that proves people don't know about these programs, says K-Rich. Some people don't want to apply because they think other people need the programs more than they do. Some don't trust the government, and some don't understand the programs. So, complicated rules and applications. The Medicare Savings Program's rules are complicated. The Centers for Medicare and Medicaid site has a ghastly instructional diagram. I'm laughing because I do know this, called Navigating the Medicare Savings Program, MSP Eligibility Experience, that goes on for 6 pages. Part of the problem is that in each state it has its own eligibility requirements and applications. In recent years, a few states such as Connecticut, Indiana, Maine, Massachusetts, and New York have increased the eligibility limits or simplified the application process in hopes of reaching more people in need. New York is helping more people qualify. New York, for example, recently expanded MSP eligibility to allow as many as 300,000 more residents to enroll. The state raised the income limits and no longer restrict the assets that beneficiaries can have. The New York application is just 1 page. We're really on a campaign to get folks into the program, says Heather Leddick, coordinator of New York's Health Insurance Information, Counseling, and Assistance Program. It's one of the nation's state health insurance assistance programs known as SHIP, which offers free, unbiased advice about Medicare savings programs and Medicare in general. So guys, great source, your local SHIP office, if you can find your local one. I will put a link to the main SHIP website, and then that way you can find your local office. Leddick says New York's Medicare Savings Program can save residents up to $7,000 annually. Other states, however, have laborious processes to apply for their Medicare savings programs. Some require filling out dozens of pages of forms and providing detailed documentation of their income, assets, and even their life insurance policies. But Medicare beneficiaries who do qualify for Medicare savings programs can apply any time. That's big, says Karish. It means you're not waiting around for the next Medicare open enrollment period. So just understand that, everybody, please. If you need that help, call Medicare. By the way, go on medicare.gov, or you can also call Medicare at 1-800-MEDICARE, 1-800-633-4227. That link is also always in my description. To continue receiving the MSP or extra help benefits, however, you must reapply every year. A guide to the Medicare Savings Program. And by the way, guys, I will put a link to this article in my description below. So be sure to click on it. You can get all this information if you forgot to get your pen and paper. Here's a guide to each of the programs with the caveat that some states have their own limits on income and what Medicare calls resources. Resources include money in checking, savings, or retirement accounts, as well as stocks and bonds. It doesn't include your home, one car, furniture, or other household items. Qualified Medicare Beneficiary Program. Qualified Medicare Beneficiary Program, QMB. The most popular and biggest of the Medicare savings programs. It helps pay for Part A and Part B premiums, deductibles, coinsurance, and copayments. To be eligible, your monthly income can't exceed $1,235 or $1,663 for a married couple, $14,820 or $19,956 annually. And your resources generally must be below $9,090 or $13,630 for married couples. If you qualify for the QMP program, you automatically qualify for the Extra Help program for prescription drugs, and you won't owe more than $4.30 for each drug covered by your Medicare drug plan. Specified Low-Income Medicare Beneficiary Program, so we call that SLMB. It helps pay for Part B premiums. Your income can be slightly higher than with QMB, $1,478 a month or $1,992 for couples, which is $17,736 or $23,904 annually. So here too, you qualify for the Extra Help program, but your maximum out-of-pocket prescription costs are $10.35 per covered drug. The other program, Qualifying Individual Program, called QI. Like SLMB, it helps pay for Part B premiums. Your income can be up to $1,600 a month or $2,239 for couples, $19,200 or $26,868 annually. This program, however, is first come, first serve. Priority goes to people in the QI program the previous year. QI beneficiaries also get the extra help assistance. As with SLMB, your maximum out-of-pocket prescription costs are $10.35 per covered drug. Qualified Disabled and Working Individual Program, QDWI. It only helps pay for Part A premiums. Most people on Medicare don't owe Part A premiums because we've worked at least 40 credits, which equates to 10 years paying into Social Security and Medicare. And it's the one MSP whose beneficiaries don't qualify for extra help. Unlike the other Medicare savings programs, to get into this one, you must be under 65, working with a disability, and have limited income and assets. The monthly income and resource limits are substantially higher than the other MSPs. Here you can have a monthly income as high as $4,975 or $6,659 if you're a married couple, $59,700 or $79,908 annually. The resource limit is $4,000 for individuals and $6,000 for couples. Extra help. So you must be enrolled in a Medicare prescription drug plan and Medicare Part A and or Part B to qualify. Your combined savings, investments, and real estate, excluding your home, can't be worth more than $16,660. That's $33,240 if you are married. To apply for extra help, submit an application through the Social Security site. Again, I will provide a link below in this description of this video. People who are eligible for the Extra Help Low Income Subsidy Program will really see their costs come down for prescription drugs. They're going to be able to afford those medications, says Levick. The Biden administration has proposed regulations to make Medicare savings plans somewhat simpler in the future. States would then need to implement the rules, which means Medicare beneficiaries probably wouldn't see them take effect until late 2024. If you have questions about any of these Medicare savings programs or extra help, you can, again, call your state SHIP office, Medicaid office, or Medicare's toll-free number. They're providing a different number, so I'm going to give you this one. This is for Medicare savings exclusively. That number is, again, I'll provide it down below, 877-486-2048. You can also visit Medicare's website. Make sure it's the official one, that it ends with GOV, www.medicare.gov. Anything else is not really Medicare, so be careful. Or also it says to visit the National Council on Aging's Benefit Enrollment Centers. I'll provide these links for you. If you have a Medicare Advantage plan, you can phone its health insurer. That's the insurance company you have that with for assistance to see if you qualify for a Medicare savings program or extra help on how to apply. What an eye-opening article. I hope you took plenty of notes and discovered some incredible opportunities to save on your Medicare costs. It's really amazing how all of these little-known programs are just not out there for our public. But our journey doesn't end here. There's so much to explore and so much more information to learn. So if you haven't already, make sure you hit that subscribe button. By subscribing to the Medigap Show, you'll be joining a community of like-minded individuals wanting to save money on their Medicare costs. Thank you so much for joining me today on the Medigap Show. I'm your dedicated host, Holly Cohen, founder of MedigapCares.org. Until next time, stay informed and be well.